I'm Dr. Michael Weisberg, and I'm the author of The Hospitalist. My role model growing up was my pediatrician, Dr. Kopp. Dr. Kopp had been a polio victim, but that didn't stop him from realizing his dream of becoming a doctor. He was the most gentle, kind person I'd met. He still made house calls, even though one of his legs didn't work and was atrophied and shriveled. And he would even come up when I was too sick to leave the house to the second floor. He would climb the stairs. I never saw him climbing them myself, but my father would describe it to me. He would hold his bag in one hand, and in the other hand he would grab onto the railing and pull himself up step by step so he could come to the second floor and see and examine me. So I think that my early experiences with Dr. Kopp in Boston Children's Hospital convinced me that I wanted to be a doctor, and from the time I was 6 years old, that's what I would always tell people I wanted to do. I think people think that when they're admitted to a hospital as a patient, that the doctor who's been taking care of them for 20, 30, 40 years is going to meet them in the emergency room, evaluate them, and then get the proper doctor or specialist to see them if necessary, or just to take care of them by themselves. That's what happened for the first 10 years or so that I was a physician, 10 to 15 years. But what really happens is that their doctor is nowhere to be seen or nowhere to be found. The insurance companies have changed medicine by decreasing the doctor's reimbursements for various things that they do. So all of medicine now is geared towards churning out, seeing more patients. Doctors in primary care fields, because of the decrease in pay, try to see 40 to 50 patients a day now, as opposed to the 12 to 15 that they used to see. Going to the hospital would be an impediment to that, because the patients are a lot sicker, take a lot more time to see. And there's also the fact of getting sued for malpractice in the hospital when the patients are sicker. So it's created a whole new field of medicine called hospitalists. Those are doctors who take care of you and see you when you're in the hospital, who may never have seen you before. I think that there are still doctors practicing, many of them, and there are doctors in my book who practice medicine for the right reason. They want to take care of patients and get people well. And I think those doctors can be found out in practice as well as in the hospital. So I still think there's an excellent segment of physicians out there, and I still think America has the best medical care possible. However, I think it's important that people are aware that when they go to the hospital, things can happen because they're not seeing their usual doctor. They're not seeing the person that's known them all these years. They're not seeing the person that's taking care of them for diabetes, adjusted their medicine, not seeing the person who's taking care of them for high blood pressure, who understands that blood pressure maybe that's a little bit higher is what they've lived with for a while and it's normal for them or it's okay for them. They're seeing someone completely new. And a lot of times that person will get specialists involved who also have not seen the patient before and who also don't know anything about them. I've written all my life. I was an English literature major in college, and I wrote some for the literary magazine in the college. I had entered a writing contest at Presbyterian Hospital here in Dallas, had sponsored and won first prize in the short story competition. So I'm someone who, my hobby and my love and passion has always been writing.